So the brief overview will be defining and demonstrating what is treatment planning and showing you the roadmap of treatment planning, the treatment plan phasing or sequencing, the authorization procedures, and the case acceptance by the patient. Done by Gulubi Vala et al. They say that it's the planning of the management of the patient's dental and oral health problems in a systemic and ordered way that assumes a complete knowledge of the patient's needs, the precise nature of the problem, and the prognosis of the of the possible management options that are under consideration. Obviously, we need to marry all of this with the patient's attitude, the motivation, and the compliance. Otherwise, it will be a failure. The importance of treatment planning is that it gives us a roadmap. Most of us drove from far places, so you need to have a roadmap. Decide what road are you taking? Are you taking the national road, or are you taking going in between the cities? Obviously, there's advantages for each one of them, and there's also disadvantages of each one of them. Treatment planning also helps you with the accurate diagnosis because you'll take the pictures, you'll take the necessary radiographs, you'll discuss the possible options, and come to something that will give you the possible, as accurate as possible, diagnosis. It will also give you the treatment alternatives for the patient and also for you. It also will be influenced by the patient's motivation, attitude, and also the finances of the patient. It helps to pre-plan your dental materials. If I've seen the case and I know that they'll come next week for certain procedures, I need to make sure that those materials are already in place. So the treatment planning part of it helps me with the pre-planning of the dental materials that I'll need in the future treatment of the patient. And therefore, with all of that, it eliminates a lot of guesswork, eliminates a lot of remakes, failure, and frustration for you, the practitioner, and also the patient as well. It makes everything to be controllable and also predictable. And now we have this DSD where you can take the picture and put it on an app and simulate, and then you show the patient the possibilities that you can do. If you don't have the DSD, you can even do a mock-up. So it's quite more controllable because the patient, they can see where they're going. Like I said, it's a clear vision, it's a roadmap. And therefore, it helps with the interdisciplinary dentistry. So you tackle into a number of disciplines in dentistry. It's either yourself or multidisciplinary by referring to your associate specialist as well. So you plan that. That is why you need to have a treatment plan. Then you can plan that in advance as well. And the most important part is the payment plan. We need to have that in place. We really need to have the payment plan in place for the patient. So it's part of the treatment planning. How is the patient going to pay you? Is it cash? Is it medical aid? If it's cash, is it hardcore cash? Is it EFT? Is it the EdCon card? Is it the monthly payment? And how do you also schedule that? And those things differ per practice. So you need to identify that with the treatment planning. The part one of the treatment planning process, it involves assessment, where you're identifying the problems, you're gathering information, you assess the risk, the prognosis, the expected outcomes, because patients will come with pictures from the internet and then they want that. So that's when you assess if whatever the patient is asking is possible for you to deliver as well. And that's when the dialogue comes in. You build the rapport at the same time, and you also discuss the treatment plan, discuss the payment plan. You have clear communication, clear interrogation. The patient asks you questions, and you also ask the patient questions. And then you develop the treatment plan. This is for ethical and legal issues. We've discussed this earlier this afternoon. So this is important as well because you have the treatment plan in place and then the patient gives you consent in order to proceed with that procedure or not, because you might suggest something in the treatment plan that the patient is not comfortable with. So you have to go obviously with whatever the patient is comfortable with, and that is part of the ethical part, and you document everything and you have the consent. And then you come to the decision making where the financial issues, like I mentioned earlier, and make sure the patient's attitude at this stage is still intact, not that they feel that now you are ripping them off as a dentist, or they feel like the procedure you are asking to be done is not what they had in place in mind, but it has to be the motivation that is the one that the patient came with in the initial stages. And then we have to deliver the treatment after all. So we have to have an agreed treatment plan, and you have to make sure that you deliver your treatment in an efficient and an effective way, following the treatment sequencing or the phasing according to what you discussed with your patient. The phase 2 of the treatment plan includes treating of the acute phase, systematic phase, the disease control phase, definite phase, and the maintenance phase. Normally, I would categorize this to initial treatment, intermediate, and also long-term. It also falls under this. I'm still going to come to that. So in order for you to have a good treatment plan, you need a comprehensive dental examination. I believe that is what we are doing now already. If you are not, we'll probably start doing it. You'll definitely need a consent for you to continue with the treatment. You'll need to take records. The pictures is also for you, for the patient, is also for the medical aid as well before the procedure starts. And obviously you need the consent to take the pictures, and the patient needs to sign for that. And you can, in your consent form, you need to ask the patient if they do agree that you publish the pictures. Some they'll say you can publish the pictures as long as you show the teeth and not my face. So your consent needs to have all of those things in place. Your radiographs, obviously we're taking radiographs, occlusion record, especially if you're gonna do restorations and prosthetic work, you really need to take the occlusion recording before you start any procedure, unless if you're just doing S&P on the patient. The pulp test, the bleeding index, CPITN, plaque index, obviously that will be mostly for your perio cases. The blood pressure, and I believe everybody has the infrared already thermometer to take the temperature for the COVID-19. We have to diagnose and educate the patient, not only focus on the treatment planning, but you need to educate. Educate about basic dentistry, educate about taking care of your teeth, educate about your teeth in general, educate about the diet as well. You can take the study models. In the treatment planning, that's where you identify if the patient is using cash or medical aid, and you can decide the payment options as well. Discuss all the treatment phases that will be involved in the treatment phase, planning and phasing. You can authorize for everything so that the patient, when they come, they know exactly what needs to be done by which stage. And you can also involve the medical aid by letting them know that on this visit, we're going to do this, on this visit, we're going to do this, and then they are aware as well. So you can book the full day for the full treatment, or depending on the patient, but then if you do the full day, it also reduces the number of visits based on the coronavirus exposure. And then you follow up you follow up on your patient. Now you've done this beautiful treatment plan, you've given the quotation, and then the patient goes home to say they'll think about it. A month, 2, 3 passes by, and you haven't even made a follow-up. So it is your responsibility to follow up on the patients, what they thought about, because some patients are just quotation collectors. They'll go to Dr. Kongo, they'll go to Dr. Kumalo, go to Dr. Buleni, and just collect all these quotations, and they compare. They're just comparing the amount, they're not collecting the quality of treatment that you're gonna give them. So you just need to follow up and also find out what is the reason why they didn't come back to you, if there's something that you need to improve or change from your treatment plan or the way probably you treated them. That's when you find out. So make sure you make follow-ups. I'm not gonna dwell on the dental examination form. I'm sure we all have this in our practices. So we have to make sure that the patient fills it thoroughly. That part as well, I'm not gonna dwell on it. With the dental examination, we need to understand why the patient is there. Um, what are their past experiences? Some they come in immediately. They come in. They're like, "Oh, I hate dentist," but they want the full mouth makeover. And I mean, already the motivation from you after hearing that is already not up to a high level. So you need to understand their past experiences as well, so that you can deal with it in your treatment planning. Maybe some patients they just want some music. So if you understand that, actually, I prefer music while you're working, then it calms me down, and I prefer this type of music. So that is the past experience that you can use in your practice in order to make sure that your treatment plan goes well. You have to find out what is the desirable changes. What do they want to do? Patients come in, they probably want to clean their teeth, but they'll tell you they want whitening. They probably have stains from smoking or coffee. So you need to understand what are their desired changes. And then you need to find out any other problems that are occurring and more. So the part of the dialogue is very, very important. We shouldn't omit it. We shouldn't just take the patient from the reception, from filling the forms and the consent straight to treatment. We need to create dialogue, and that dialogue is building rapport. Okay, dental examination form, we all do that. I'm not going to focus on it. So I'm just reminding you of the things that we need to involve in our dental exam form. And the charting, we need to do a thorough chart. We need to record, obviously, our findings from the radiograph that we have taken. You can also include the session of the findings from your dental pictures as well, because sometimes when you've taken the picture, the patient is gone. When you're on a relaxed stage, then you go through all your pictures and your radiographs. You find things that you didn't see the time the patient was sitting at the chair because of the time, because of whatever that was going on. So you include this as well on your dental examination, all the findings you put in there. Another thing that helps with the examination is to ask leading questions, because some patients don't even know how to express themselves, but they know what they want. So you can just say, "Are you aware that you have a fractured tooth? Do you know why is it like that?" And then they'll probably say, "Oh, probably I eat ice or I chew bones." So you make them aware that their habit is affecting their teeth. So if they will have to do a crown on their tooth, obviously it's going to break as well. Or you have to plan that, since I know this patient is chewing on bones or ice, therefore the type of crown that I do will have to be able to resist such forces. And then you just find out, has anybody explained to you the issues, probably from the previous dentist, the way you're functioning, probably you're eating only on the left side or only eating on the front teeth. So you make people aware of their habits as well. That is part of the treatment planning. Are you aware the financial implications of treating the tooth once it's severely damaged? And if the patient say no, then you explain that's part of the dialogue. And are you aware you're supposed to visit your dentist every 6 months? They'll tell you, no, actually, I thought my medical aid only pays once a year. So I didn't know. Now I'm going to come. I'm going to bring my family. I didn't know. Um, Has anyone shared any consequences of not treating this issue? Probably the patient just went for an extraction to the other dentist and they just pulled out the teeth and then they never explained the importance of brushing, the flossing, etc., etc. So now you make them aware that your teeth are in this state because of this. And then just throw in some fun there. Do you understand anything about teeth except that you hate your dentist? Obviously, you choose your weapon of choice to make sure you have proper recordings. It doesn't matter what you use as long as you have the recordings. Then you collage your pictures, making sure that all the necessary things are visible for your diagnosis and treatment planning. Still part of the dental examination form, once you've collected all your information, then you can put down your diagnosis. From the diagnosis, you have your treatment plan. Immediate treatment plan, what are we doing immediately on this patient? What are we doing intermediately? And what are we doing in the long term? You can just jot down small things. So this is part of the treatment planning or sequencing or phasing I was talking about: immediate, intermediate, and long term. With your immediate treatment plan, obviously you do things that the patient came for at that moment. It's different for a patient with a smile for the smile makeover, but for most of the patient, they come just to alleviate pain. They have incision. You can do some incisional drainage. You remove the tooth, or you do some the temporal filling on the tooth. You desensitize, or you do an emergency root canal, or you can even do the full root canal treatment on the tooth. You can do some prevention, your PRR, your fissure sealant. Sometimes you just need to explain the patient that they need to brush properly. Or not only explain, but demonstrate, show them what is brushing properly. Have your model there, your tooth and then your brush. Show the patient to brush in circles, show the patient how to floss. And if it's your existing patient you've explained before, reinforce again, educate the patient again, diet instruction as well. What things they're not supposed to be chewing on, like ice and bones and stuff. If there are people who, especially ladies, they prefer to eat a sweet so that they won't eat food. So you check such things and you cancel such things, because obviously they'll eat a sweet and then it's going to cause more caries than somebody who's eating proper food throughout the day. You can do your cleaning, your fluoride treatment, and you can just check the prognosis of the teeth that were already treated before. The other important part of treatment planning is referral. We do not have to treat everything that is presented to us. Part of your treatment plan includes referring. Patient comes in, they have the complaint, you assess, you do the whole exam, you take all the pictures, take all the radiographs, and then you discuss. As you're doing the dialogue, you explain, Ms. Tono, you're complaining of this, but the person who can help you with this is Dr. Hloki, so I'll refer you to her. So such things are very important as part of your treatment planning as well. Or you can treat certain things. Probably the patient wanted a root canal treatment and you feel that you're not competent enough to do a root canal treatment. So you can say, I'll do all the other fillings, but I'll refer you for a root canal treatment. So it's very important for you to identify that as well. So on the immediate treatment planning, then you can do the medical aid authorizations. So most of the medical aids, they'll say you can do a maximum of 3 fillings or 5 fillings per day. Or they'll just say a maximum of 5 teeth. So you need to understand a maximum of 5 per day, or in general. Some they'll say 5 per day, or 5 in the immediate treatment, but unlimited throughout the year. So through that, you do whatever you need to be done on that day, and everything else that needs to be authorized, you authorize for, and you book the patient to do all the data treatment on the intermediate phase of the treatment. So the authorization procedure includes authorization form, the lab quotation if it's needed, dental radiographs, dental pictures for complementary, just to show them that it is a problem. Because some medical aids, if you authorize for a crown, they'll tell you the tooth is not fractured up to a third or something. Some nonsense, sorry. Yeah. And then you can add an extra motivational letter to the letterhead. So the dental pictures, they help to show that whatever you're talking about, it's there. Because sometimes the x-ray, or it doesn't show what the picture can show. So you just bring the patient to them. This is the patient through an email with the pictures. So your authorization form obviously needs to have a date. You need to identify what you're authorizing for there. I don't have a pointer. Okay, kindly authorize for, and then you write dental fillings, crowns, veneers, dentures, implants, and then you put your patient's details, the medical aid details, and the main member's details. Same thing with authorization form. You need to have your clinical codes, your ICD-10 code, your tooth numbers, and your amount. If you have enough space on the same page, you can put your motivation on extra information so that they don't ask you. Just give it to them at once. But if it needs a lot of space, then you can just put it on a separate letterhead and then just tell your story. All right, on the intermediate treatment planning, it's control, obviously, dental restorations, implants, dentures, wisdom tooth, whether it's in the chair or in theater, smile makeovers, habit breakers, root canal treatment, whatever you've authorized for in the immediate treatment planning. And the long term is obviously your maintenance or the management of the disease, if it's a period disease, oral hygiene demonstration and reinforcement as well. Oral health education and diet counseling, that one never stops because people feel that now that they have crowns, the teeth will never be rotten because it's covering the entire tooth. So you still need to do that. So we have some complex cases whereby you can phase them also to immediate, intermediate, and long term, like your orthodontic treatment, your period treatment, some restorative treatment, some implants. Okay, with all the implants and the smile makeovers, it's not a case that you can do on an immediate case alone. So you also phase the treatment according to the treatment need. So I made an example there with this case. The patient who's complaining that, okay, this is a guy, so they were having fun, and the fun broke the tooth. So he wants to look good again, so we had to make a plan. Immediate treatment plan is obviously the root canal treatment, post and composite filling. Intermediate treatment plan is, okay, immediate treatment plan is comprehensive exam, the dialogue, explain to the patient, you've broken your tooth, completely horizontal, there's not much ferrule. We'll probably do a composite filling. It won't last long. You'll need to do a crown later on. But in the meantime, I'll put a filling for you, a composite. You need to come back though, so that we can do a crown for you, a much long-term thing. So obviously demonstration, do a code or authorize for the next treatment for the crown and scan and polish. So in the intermediate phase, we do the crown, the S&P, oral hygiene reinforcement and diet counseling. Long term is obviously maintenance and oral hygiene instructions, reinforcement. Case 2, patient is just worried about those black spots in the front teeth. And obviously there's more that you can see as a dentist. So you educate the patient as well about that. So immediate treatment plan is just a comprehensive exam, dialogue, consent, pictures, radiographs, composite restoration on tooth 1, 2, 1, and 2, oral hygiene instruction demonstration, oral health education, and diet counseling. And then you can do the authorization. Okay, on the dialogue, that's when you explain to the patient that you definitely need braces. Can you see the state of your teeth? Remember the questions that you probe, you give the patients, you ask them so that they can look at themselves and actually realize that actually, yeah, my teeth really need braces, and then later on we can do crown lengthening and show the full length of your teeth because they look like they're short, but they're not. That's part of the education as well. So our intermediate treatment plan will include the orthodontic treatment, oral hygiene instructions, diet counseling, gingivectomy. Long term is maintenance, ortho retainers, oral hygiene reinforcement. Case 3, patient felt like gold must fall. It is time. I need white teeth. It is time for white teeth. We remove the gold and she's like, no, that gap is just too much. I cannot handle it, doctor. When I talk, everything just goes out. Do something. So treatment plan, first examination is comprehensive exam, dialogue. You talk, you want to find out why did you have the gold tooth there in place. And then they tell, no, I wanted to close the gap. And the only thing that was available was this. And then you give them options that, okay, we have an option of removing that and then putting braces. Put your teeth back because mostly they're outside. Even if you are closing your mouth, the teeth do not allow you to close your mouth. So we can help you with you closing your mouth and then also closing that gap without having that gold tooth if you no longer want it. The patient is like, awesome, I want that. So what do? We do exam, dialogue. That's part of the explanation, education to the patient. We do the consent, pictures like we did, radiographs. Then we did the S&P, remove the gold in there. We gave her composite restorations there. We'll probably change them later after the ortho is finished. But for now, composites are good because I can bond them quite nicely with orthodontic treatment. Obviously, the demonstration of the oral hygiene and health, oral health education, study models, authorized and caught for the orthodontic treatment because that's the only thing she needed. Then we started with our treatment. Intermediately, obviously, we need to cancel with the diet and the oral hygiene instructions continuously because you don't want to end up with a beautiful class one, but all the teeth are caries now. So you keep on repeating yourself like a broken record. Long-term maintenance, ortho retainers, oral hygiene instructions, reinforcement, and maintenance. You don't want the relapse. So you make sure that the compliance and also the motivation of the patient is still in place, even if it's 18 months later, so that they wear their retainers to keep the teeth in place. Case number 4, doctor, I want my smile to be better. I don't understand what's going on. Help. Obviously, you can see that the 1, 2, and the 2, 2 are missing. The oral hygiene is, it's okay. Shh. And then we have the 3, 6 day root rest and most of the teeth requiring dental restorations. So first I need to find out why did she even remove the 2, 2, the 1, 2, and the 2, 2. She doesn't even remember why. She doesn't even know if she had them before. So you just understand that this patient lacks self-awareness. So you need to put motivation on this patient, educate, take the radiographs. Obviously, we will need ortho, so we took the radiograph for ortho. So immediate treatment plan, obviously, we did the comprehensive exam, the radiographs, SNP. We discussed that let's just do quadrant 2 and quadrant 3 at once. So meaning you remove that root rest and do all the restorations on the upper and lower. So when you come back next time, we just focus on the right side, the quadrant 1 and quadrant 4. And then after that, you can start with your braces. And therefore, with all the pictures that you've taken and all the medical, the radiographs, then we send for authorization to the medical aid. So intermediately, we do the restorations of quadrant 1 and quadrant 4. We do a bit of period dip scaling there because you saw on the radiograph that she needed that as well, and also orthodontic treatment. This was not on the same day, it was phased as well, the intermediate phase as well. And also long term, you can discuss if the patient's gonna need implants or the bridge. You discuss the pros and cons, you discuss the financial implications of everything, the dental implications as well of a bridge compared to an implant. The last case, the patient felt like there's something wrong with her teeth. So she had to put some jewelry there to distract herself from looking at her mouth because she was really bothered. So she wanted to find out if there's something that we can do. So on this visit, we only spoke. So these are all the front, the teeth occlusally. So we took the radiographs as well because she needed some ortho as well. So we did all those. So obviously, first exam, we just spoke and discussed all the treatment possible options. So I told her we definitely need the fillings there, definitely need ortho, and definitely need to remove that jewelry. Luckily, she agreed. She didn't laugh at me like you guys are laughing. And then she said, okay, let's authorize for everything. I want to do everything in one day. So we did that. We took all did everything. So when I sent to the medical aid, I sent the authorization letter for the restoration, and I sent the authorization letter for the thingy, the author treatment. And we booked the entire day. Yeah. And we booked the entire day for her. It was fun. So we did all those fillings and we placed the braces and we reinforced oral hygiene because obviously we don't want those cavities to come back again. I cannot disclose the medical aid, but they approve for everything. Long term, obviously, it's maintenance, retainers, and yeah, oral hygiene instruction, reinforcement. So I need to bring this to your attention. This is an example. Do I need a pointer. I feel like I need to be a teacher at this moment. Okay, so this is the quotation you give to your patient. So the medical aid will take this and then they'll tell you how much they are willing to pay and how much amount they will not pay. And then you discuss this with your patient before you even start the treatment, that your medical aid says they will cover this. They won't even look at it because it's their scheme exclusion. So it falls under that. Thank you. Where do I press? Yes. Okay. So you write that quotation like I showed you, and then on the clinical course part, you write all your codes. You write your ICD-10 code. The quantity is based on the tooth numbers. So this is what GEMS is offering to pay currently. This is what Bonitas is offering to pay currently. This is what Discovery is offering to pay currently. So I just draw 3 so that they can fit in the presentation. Otherwise, if I had to take all of them, they won't fit. So I made an example. There's Doctor 1, there's Doctor 2, and there's Doctor 3. And there's also this doctor who just accepts whatever James is giving them. And there's also the doctor who just accepts whatever Bonitas is giving them. There's also a doctor who just accepts whatever Discovery is giving them. So you decide which doctor are you. Do you just accept whatever the medical aid is giving you, or you set your fixed prices? The nice thing by fixing your prices is that they become fixed for cash and medical. So you don't get a problem of having a patient saying you are split billing them, but it has to be a balanced billing. With this, it's balanced billing. We have one amount. I'll make an example. Dr. 1 is charging that much. GEMS is offering that much. The balance would be that the patient needs to pay from her pocket. There's also a possibility that within this code, GEMS will say, that is not part of our inclusion. We are excluding that as part of our payment. That needs to be included in that. So you'll minus it from there and then it comes here. The content, the dialogue, that's where it's coming. You discuss with the patient. Your medical aid says this. The balance is going to be this. So how are you paying this? Are you paying it? It depends on the practice. Some practices they allow the patients to pay after the treatment is done and they never come back. Or you just tell them to prepay on the day of treatment, then they make sure that everything has been paid off. Then you can start with the treatment. Or you can be doctor number 3, and then obviously the balance would be that the patient will need to pay you on the day of treatment. By the time they leave the practice, that amount needs to be in your account. Does it make sense? Okay. Okay, so we did all those feelings. Okay, this is the part that a lot of people get confused with, but this is what you explain to your patient. That as a doctor, I have my fees. The medical aid, just like the insurance, they cover what they cover. So you choose which medical aid you choose. So at the end of the day, I have my own fees. I charge what I am worth, or the quality that I provide to you. So this is part of your consent. If you want to include this, you can include it. And then they sign it and they're aware of it. I'm just going to go through the full orthodontic treatment treatment plan. So you'll definitely need to chart, take your pictures, take your pen and trace yourself, do some study models, even though it's not necessary these days, because you have pictures that do a lot of things for you. Detailed authorization form on orthodontic treatment quotation. So this is your form. We all remember this from school. If you're not using it currently, the molar relation, the angle classification, all those things are still important. The form is also important if you are doing a small makeover, you need to fill the same form because the same principles apply. This is part of the form as well. This is part of the form with the probing questions, which is quite different. Um, you just ask question, do you have any spaces that you don't like? Do you like the color of your teeth? Even probing for whitening. Do you really like the color of your teeth? Are you aware that your teeth are chipped? Right there, can you see that? Okay, okay. Obviously, you take your pictures, you collage them, you send them to the medical aid. It's also for part of your records where you file it in. You can compare when you started the treatment and the last day of treatment, what you've achieved, so that the patient can remember where they come from. Sometimes on month number 3, the patient will tell you, but I don't see a difference. Then you pull up this picture, and they're like, oh, then you know. So it's very important to have these pictures. The radiographs, we all know about them. And then back again, the money issue is very important. The quotation. So when you come to a quotation, you include everything. You include how many times you're going to see the patient. So this one, the treatment is going to last for 18 months. So I do say that I'll take the pictures, I'll obviously wear the gloves and mask and my instrument for 18 months. So I put it in the, write all the codes that you're going to need. You write the code of the treatment you're going to do. So this is a fixed appliance, 8879. That's the amount. Obviously, you write your own amount. I just use the medical aid amount here. And then you write what you're going to need at the end of the treatment. Obviously, you're going to need the retainer and also the lab quotation. So you make the patient away. So you don't have to put the lab coat there if the patient is not sure which retainer they want. Sometimes they'll just want wires that are fixed on the mouth as a retainer. So that part you can exclude. So I'll just show you that you can even include the lab coat there to show that full amount so the patient is away. Then they can go to the Dr. Kongo for another coat and Dr. Twala again, and they compare and then they decide which one they take. So you take that and you take it to the medical aid, and the medical aid will respond to you. They will tell you how much they are willing to respond and how much they are willing to pay and how much they're not willing to pay. So for an example, with the orthodontic treatment, you explain to them that you'll want an initial fee of so much. So for an example, with this one, I said I wanted 6.6 as an initial fee. And the medical aid said, no, we'll give you 4.9. The other portion the member needs to pay. So at the time I place in the braces, obviously I want my money. I'm not placing my braces when that is not paid because the medical aid has paid that part. So with the orthodontic treatment, obviously it's 18 months, so I allow that the payments must be made monthly. The medical aid, I want this amount per month. The medical aid says they're going to give me that. So I need that from the patient every month. So they need to decide if it's EFT, if it's EdCon, if it's Mashonisa, I don't care. I want my money. And then with the periodontal treatment authorization, I just made example with the thorough examinations with the ortho and the perio because it's the most prevalent these days. Every patient that you see, it's either need perio after the restorations. First restorations, it's perio or ortho. And then the other things. So obviously with your perio, you need your chart, your CPI index, your bleeding index, plaque index, the pen and the full series periepical radiographs, a detailed authorization form, and a periodontal treatment quotation. You do that like you did in varsity. Obviously, the charting never goes away. Period pocket, bleeding index, plaque index. You do all of this. And then immediately the medical aid see this. They approve. You do your CPIT index, your DMT. You give them the radiographs. You give them the full series radiographs. But most of the time, a pen alone will do. A pen alone will do for period treatment authorization. Yes, for period. Then you can do the full series for extramural activity. And then periodontal authorization form, like I said, You explain the, what is the treatment? Okay, obviously the date, today, period treatment, your patient, Thembeka Buleni, medical aid, whatever, remember the details that you need to put everything in there. And then your amount as well. So you write the full treatment. Obviously, this is your initial treatment, just the consultation. And then the teeth, you are root planning. If you can see there, there's like 6 teeth, but I said the times 2 because the 8737 is per quadrant, not per tooth. But you need to tell them which tooth numbers you're root planning and your amount. Obviously, the maintenance phase. You tell them that you're going to maintain and how you're going to maintain it. I'll show you just now. And the amount, and that's the total. And then you can give them the diagnosis and extra motivation there just to make sure they never decline. So with your motivation, you can just tell them, actually on the first visit, this is what you'll do. On the second visit, we're going to do this. On the third visit, you're going to do this. And maintenance, this is how I'm going to maintain the patient. And then they'll respond and tell you, we approve based on this and that. They'll even tell you that if the patient does not comply, we're not going to cover it next year. Because patients, once they feel that they are fine, they never come back. So it's your responsibility, and the motivation of the patient still needs to be high in place, and you also need to motivate the patient. Let them know if they don't come for the treatment, they need to complete the treatment so that the medical aid approves the next time for the follow-up visit as well. Are you still alive? Still awake? Okay. All right, we made it. In summary, treatment planning just gives us the full picture on what you want to see, the result, and where we're going. I mean, it provides predictable results because it's more like you make a simulation of what you're going to do, and you make the patient aware of it, and you also are aware of it. So it gives you that confidence that, yeah, I'm showing this patient this. I mean, they understand. And they also have the confidence in you back. It gives the patient clarity of what I'm here for, because patients really feel that they don't like dentists. So if you explain to them, they feel empowered. So you need to make sure that you empower your patient. It gives you a peace of mind as well, and the patient. And you provide estimates for the finances so that the patients know how much their smile makeovers will cost them. And then they'll post on Instagram that their doctor charged them so much for their smile makeovers. They'll tell, just like they post about the gold teeth, that they are expensive because they have the gold teeth. Now the smile makeovers are the new gold teeth. And they post about it, that I have spent so much grand just to have my smile made over. Obviously, you'll enjoy your career. It won't be a suicidal. Yeah, it's suicidal. When we were in university, we were told that dentistry is the most suicidal. But when you do all of these things, you tend to enjoy your practice because you have a clear vision for yourself. You have less blood pressure, you know. Colleagues, I'm done. Thank you.